Enzymes are biocatalysts or proteins that speed up chemical reactions in living organisms. They do this by lowering the activation energy of the reaction, thus allowing it to proceed much faster. Our aim in this video is to explore the diagnostic and therapeutic uses of enzymes and how they may benefit us, their limitations, and some disadvantages. Come with us as we walk you through enzymes and their many uses in medicine.
The activities of enzymes in bodily fluids such as plasma or serum is very important, especially clinically, because enzymes are oftentimes used for prognosis or diagnosis, can be used for both or either or. In the circulatory system, enzymes are divided into two groups. You have non-functional plasma enzymes and functional plasma enzymes. And both of them can be used for prognosis and diagnosis, right? So when we speak about plasma functional enzymes, they're mainly found in the plasma versus anywhere else in the body. And they're synthesized in the liver, they're made in the liver. So therefore, any damage to the liver will directly affect their function. For example, if there is impairment in liver function, it will lead to the reduction in the activity of the plasma functional enzyme ceruloplasmin, which can lead to Wilson's disease. Wilson's disease is the accumulation of copper in the blood system. The enzyme ceruloplasmin is responsible for transporting copper. So you can see that difference there. Non-plasma functional enzymes are commonly found in tissue. So your muscle tissue, your skeletal tissue, your brain tissue. Once high levels of these enzymes are observed in the blood or the system, it indicates tissue damage. For example, damage to muscle, skeletal, or brain tissue will cause creatine kinase to leak into the bloodstream, and once detected, will indicate tissue damage.
Enzymes are biocatalysts, and because of their remarkable properties, they are extensively used in medical diagnosis. Researchers in the last 2 decades have concentrated more on enzymes such as creatine kinase MB, alanine transaminase, aspartate transaminase, acid phosphatase, and alkaline phosphatase for clinical applications. Enzymes are the preferred markers in various disease states such as myocardial infarction, also known as a heart attack, jaundice, pancreatitis, cancer, and neurodegenerative disorders. They provide insight into the disease process by diagnosis, prognosis, and assessment of response therapy. Diagnostic enzymes are used in medicine to detect abnormal metabolic activities, infections, and disease by measuring the activity of concentration of enzymes in biological fluids. For liver disease, measuring the levels of alanine aminotransferase and aspartate aminotransferase in blood serum can indicate liver damage or dysfunction. Enzyme linked immunosorbent assays can detect antibodies or antigens specific to infectious agents. For prostate cancer, measuring prostate-specific antigen levels in blood can help to detect and monitor it.
Cardiac biomarkers, creatine kinase and trophine. So creatine kinase and trophine are key biomarkers and are used to detect myocardial infarction, which in other words known as heart attacks. The mechanism of creatine kinase is an enzyme involved in energy production in muscle cells. Creatine kinase is the heart-specific isoform of CK. Trophin, a protein complex with subunits of T and I, specific to cardiac muscle, released into the bloodstream when heart muscle is damaged. Well, the application for both of these enzymes, both of them are measured in blood test to diagnose heart attacks. Trophin is considered the gold standard due to its higher sensitivity and specificity compared to CKMB. We're looking at the enzymes, amylase, and lipase. These enzymes are used to diagnose pancreatic disorders and pancreatitis. The mechanism for amylase, they digest carbohydrates mainly from the pancreas and the salivary gland. Lipase digests fats produced by the pancreas. The relevance of these enzymes is to diagnose acute pancreatitis, chronic pancreatitis. Yes. And the application for these enzymes, there are elevated levels diagnosed for pancreatitis and pancreatic cancer, with lipase as the preferred marker due to its high pancreas specificity.
Enzymes are essential in biopharmaceuticals. They regulate biochemical reactions involving specific substrates. They also provide precise control over biological processes. Categories of therapeutically significant enzymes. Fibrinolysis. This is of blood clots. An example of an enzyme is streptokinase. We also have cancer therapy, which target cancer cells. Example is the L-asparaginase. We also have enzyme replacement therapy, also known as ERT, which treats genetic disorders. We have synthetic production for purity and consistency. Therapeutic enzymes are also produced through fermentation of microbial strains, which are primarily bacteria and fungi.
Effective enzymes are by targeting and modifying certain biochemical pathways. Asparaginase is used for leukemia treatment. Asparaginase catalyzes the conversion of asparagine into asparic acid and ammonia. It is used primarily in treating acute lymphoblastic leukemia and cancer affecting white blood cells. Cancer cells in acute lymphoblastic leukemia rely on external sources of asparagine for survival. As a result, they cannot produce enough on their own. Asparaginase depletes asparagine levels, effectively starving leukemia cells, while normal cells remain unaffected due to their ability to synthesize asparagine. Blood clots are essential for wound healing and can become dangerous when they form in the wrong place or don't dissolve properly. These unwanted clots can block blood flow to vital organs, causing serious complications. For instance, a clot in the brain can lead to a stroke, while one in the heart can lead to a heart attack. So the tissue plasminogen activator is an enzyme that converts plasminogen to plasmin, which is crucial for breaking down blood clots. Administrating tissue plasminogen activator enhances plasmin production, which degrades fibrin in the clot, restoring blood flow. So the clinical use utilized in thrombolytic therapy for emergency treatment of ischemic stroke, myocardial infarctions, and pulmonary embolisms. Lactase breaks down lactose as sugar in milk into glucose and galactose for easier absorption. People with lactose intolerance lack sufficient lactase, leading to undigested lactose and causing bloating, diarrhea, and cramps. Supplemental lactase provides the necessary enzymes enabling lactose digestion and symptoms release. So the clinical use of lactase is available as over-the-counter supplements in liquid or tablet form, allowing individuals to consume dairy products without discomfort.
Creatine kinase limitation. Creatine kinase only measures one specific enzyme, creatine kinase myocardial band. While this makes it highly specific for heart damage, it does not provide a comprehensive assessment of the overall heart health. Another limitation is replacing alternatives. In recent years, other diagnostic markers and tests have largely replaced the creatine kinase myocardial band, such as troponin. For instance, this is now a preferred marker for detecting heart muscle damage due to its higher specificity and sensitivity. Another limitation is false positives. While the creatine kinase myocardial band is specific to the heart muscle, certain conditions or medical interventions can lead to false positive. For example, strenuous exercise or skeletal muscle injury. The drawbacks of CPR testing: lack of specificity. While this test can indicate inflammation, it cannot pinpoint the exact cause. Further tests may be required to identify the underlying condition. Normal levels can vary. Levels of CPR can fluctuate in response to various factors such as age, gender, and overall health. Interpreting the results requires the individual to consider these differences. ESR has some disadvantages since it requires a large volume of sodium stearate and at least 1 hour of testing time. Enzyme assays have limited incubation temperature, temperature stability, and this can affect the precision, which limits the application range.
A common limitation of therapeutic enzymes is their short in vivo half life. I want to highlight that one of the major challenges of using therapeutic enzymes is their quick degradation once administered. The body tends to break them down and clear them out rapidly. For instance, in the case of Fabry's disease, patients treated with recombinant alpha galactosidase A experienced enzyme clearance within 1 to 2 hours post infusion. There are current solutions like pegylation or encapsulations that are being developed to help extend the activity of these enzymes. Now, let us expand on how immune reactions to therapeutic enzymes can lead to various toxic side effects. These reactions can range from mild symptoms like rash or fever to more severe outcomes such as autoimmune disease or anaphylaxis. Acute reactions like hypotension and bronchospasm may occur after enzyme administration. The administration of therapeutic enzymes can provoke immune reactions, often leading to the development of antibodies that reduces treatment efficacy. For example, 88% of Fabry's disease patients develop antibodies against recombinant alpha galactosidase A. Now let's discuss lack of tissue specificity. Enzymes may not discriminate between healthy and pathological tissues, resulting in off-target interactions. Patients with mucopolysaccharidosis (ERT) has been linked to eye complications such as corneal clouding and optic nerve degradation. Now let us move on to long-term considerations. Prolonged or repeated enzyme treatments can exacerbate immune responses, particularly in patients with pre existing antibodies.
Now, it's quite clear that enzymes offer huge advantages when used in medicine as they are highly specific, targeting only desired molecules. This in turn reduces the side effects. They also act as efficient catalysts, working in small doses under mild conditions, and being biodegradable, they break down naturally. This lowers the environmental impact. No, these advantages also comes with disadvantages because with strength comes limitations. Their high specificity can cause them to become restrictive. Since they only target one substrate, this makes treatment complexity increase exponentially. Efficiency can also be impacted by environmental inhibitors or the need for cofactors, which is very common in enzymes. Enzymes degrade quickly, but this also means that potentially there may be a need to dose the patient more. This might increase the burden on the patient and the cost to the patient because they would have to be spending more to obtain medications.
The high applicability of enzymes for treating many ailments as well as the developments being made to solve their related limitation has resulted in a constant increase in the use of these treatments, which will only grow in the future. Innovative biotechnology solutions are being developed right at this moment to address the limitations of enzyme medicines. Nanoparticles, virosomes, liposomes, and erythrocytes are being investigated as drug delivery systems. Furthermore, molecular modifications are being performed to increase enzyme properties. Conjugation with biomolecules such as antibodies, DNA, or metabolites are being investigated. PEG modifications are being employed in therapy. At the same time, fresh approaches to enzyme treatment applications are being investigated for cancer, neurological illnesses, joint difficulties, inflammation, and infections.
The use of enzymes in diagnostics is relatively commonplace, and when compared to the use of enzymes in the treatment of diseases, is relatively cheap. Enzymes have a long way to go in order to become commonplace in terms of treatment of diseases in an affordable manner. All our research discussed today will help to push the conversation forward, and we hope to be a part of it.